Right. Good morning, everyone. It's Dr. Sarah Moore here, and I have the great pleasure of speaking with my friend, Marika Brock, today. Marika is a mother of three children, and she lives in the same area as me in the southwest of Western Australia. And Marika's agreed to have a chat with me about her experience with pregnancy, childbirth, and becoming a mum. So thank you very much, Marika.
Thank you.
So, Marika, I thought we would just start. Perhaps you could tell me a little bit about your experience of your three pregnancies, births, and the neonatal postpartum period.
Mm-hmm. Yeah, so my three pregnancies were all pretty good. Like for myself, health-wise, I was really blessed, and the care was quite different each time, actually. So my first child, I've got a 9, 7-year-old, and a 1-year-old, and the first one, I didn't know what I was doing, of course. Just went through, I guess, the public hospital care, which was fine. I had actually thought I would like to have a home birth, but I kind of figured it out a bit late in the piece and, thought that's fine. We'll just go through the hospital this time. And it was great. I went and had my sessions with the midwife, just my visits during the pregnancy up at the hospital in East Freo, and it was fine. The birth, I had a doula. I did decide to get a doula. So she, was with me towards the end and then actually at the birth. I would say make sure you get a good doula if you're going to get a doula, because she was, a bit flaky, but she was sort of pregnant as well and had a bit of trouble. She couldn't be there my whole birth, and certainly being my first birth, I really needed her at the end, when it was a very long birth. But very long birth, which surprised me, didn't quite know that could happen, but obviously it's common enough with first births. And then it was fine though, healthy. Everyone was healthy. My little boy was fine. It was all good. The care afterwards in hospital was pretty good. Back then you could stay for 2 or 3 days. The midwives are all wonderful. I found the conflicting opinions on how to breastfeed quite tricky. Breastfeeding was very difficult for me with all three of my babes, but I had, a condition that was unusual and a lot of them hadn't seen it before. So that was sort of research I found out along the time, later. But we ended up leaving the hospital because it was all a bit full on breastfeeding advice, but it was great. Got home, look, we did have trouble feeding him for a long time, but there were a lot of services that I, used to help me with that. And eventually we got him on the boob and that was all good. Second time round, I had my second baby pretty soon after, 18 months difference. And that one I knew I wanted a home birth. I knew the midwife I wanted, so I was right onto it. And this amazing woman who I'd met in my first pregnancy, and she, luckily enough, she was able to be my midwife. I went through the community midwifery program in Perth, and she had all her visits to me at home, which was perfect. I had a baby as well. So, and she just became quite a great trusted friend. So I felt very safe, having her at my birth. And I felt very comfortable with home birth as well. I'd had the hospital experience. It was fine, but I thought I can do this. I had no pain relief in that first birth. I thought I can do this at home as well. And I'd read some great books about that too, and about trusting your own body, and women are meant to birth. It's a normal, healthy thing, nothing to be scared of or need to medicalise it. So that birth was great, very quick. He came out like a rocket, and actually the midwife only made it with 15 minutes to spare. But I didn't, I guess second time around you weren't too panicked. It was just like, you get in the zone and yeah, that he came. Tricky postpartum, is that right? Postpartum period afterwards. He was just, he was a reflexy baby, a few issues there, and I actually had postnatal depression, but it was probably something that was coming on a bit when I was pregnant, and my midwife had already picked it up. So I'd been to see a counsellor and stuff. Unfortunately, couldn't ward it off. I still had it. But, I also had a lot of good people around me to support me through that. And I looked at various alternative therapies to help me through it, and I did get some good help. So fast forward a number of years, and then finally thought I could have another baby after having the two so close together. All that went with that. And I'd moved down south by then, Dunsborough, and my beautiful friend Sarah lived down here, and she offered to, take care of me during that pregnancy. So, which was wonderful. It's so great to be able to see a friend and feel so supported, in that role. I felt really blessed. So Sarah took care of all my appointments and my visits, just as a GP. And we both knew I probably wouldn't need any special help at the birth, and that was the case. You know, I was at the hospital, and I was very fine with that, going to Bustleton Hospital. The midwives are all beautiful there, and yeah, the birth was uneventful, gorgeous. Again, born in a pool. My little girl was born in a pool. So was my second son, who's born in a pool at home. And again, aftercare, wonderful. They left me alone. I think they thought 3 babies, she's right, and they did just leave me alone a lot with it. And really, it's been a beautiful experience, you know, with my little girl. Just I guess that confidence you have with, you know, having had a few by now. So, yeah, there's a lot of words. So
yeah, no, that's beautiful, Marika. Thanks so much for sharing all of that with us. You've sort of mentioned or alluded to it already, but I'm really keen for you to sort of really identify what it was that you valued about each, or the care that you received in each of your pregnancies, because as you said, they were quite different, each of the way that you received your care. And yet it sounds like you really, there were parts of each of those experiences that you really appreciated and valued. So would you mind just sort of, I guess, you know, really honing in on what it was that was important and valuable about each of those experiences? Yeah.
Sure. I think first time round, you don't necessarily know what you need. And that was definitely the case for me. You know, just seeing whatever midwives at the hospital, I actually don't remember a lot about it, you know. I do think having a support person who either is going to be there with you at the birth is a great idea. So either a doula or someone like that who's outside of the system that you're in, if it's the hospital, that is with you and someone you feel safe with and trust. And husband's not always going to be that person, and that's fair enough. It can be quite full on for the dad too, to experience birth. It's, yeah, you know, he's not done it before. And, you know, so I think having a care person, probably a woman, is what you should have. I think that feeling safe and having someone who's going to advocate for you is a big thing. And I loved that my midwife in the second pregnancy, I knew, you know, she was going to be at home with me. So I felt completely safe and trusted her skills, and I knew we would be fine. That's a big part, I think, that feeling safe. And then third time round as well, you know, it was wonderful to be able to come and see you, Sarah, you know, and I mean, I didn't have many fears, but you're always there to be like, this is all good, this is fine, everything's going how we want it to, da, 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 you know, and just knowing you're in safe hands, I think, is probably the biggest one, you know, and someone you can ask anything of. And I must say, both my midwife and the second one and yourself, Sarah, you're always like, if you need any information here, you would point me in the direction of anything I might need. And that's also great. You need to have someone who's, you know, feeding you, you know, answers to your questions or where to get them. So, yeah.
Great. Okay. Thank you. And I guess, you know, leading on from that, I mean, you've kind of alluded to this already, but what's the sort of advice that you would give to women, you know, in the position you were back before you had your first child, who were pregnant or planning a pregnancy? What sort of information or education would you suggest that they could seek or look for to help them make decisions about, you know, their birth and their pregnancy care provider?
Yeah. It's a tricky one, because I feel like with my first, I didn't have a lot of information and I didn't really know where to get it, you know. I don't even know how I bumped into the idea of a home birth, but I read a book, and like I think I mentioned, I was already too far gone in my pregnancy to get onto this particular midwifery program where you can have them at home. But yeah, I found that tricky, because I always thought you had to go with an obstetrician only, and that was the only option. Except my mum was there saying, can't you just go to the public hospital? That's what she did. And I just didn't know, because the first question a lot of people ask you is, who's your OB? And you're like, I didn't even know what one was. I was like, what's an OB? I just had I was young and I had no idea. And even still, people ask you that, and I've not had one. You know, you were my GP, Sarah, but that's how you were acting, you know. So I think probably asking people, but be aware that just because all your friends have gone a certain way doesn't mean there's not other options. You know, like I was certainly a bit out there wanting a home birth. A lot of people I knew were like, are you crazy? And then I also had a lot of friends who'd done it themselves. I'm like, sure, borrow my birth pool. You know, like it was, I guess you slowly attract those people too, you know. So there is a lot out there. Probably GP is a good option, but yeah, I mean, loads to say online, but maybe that's an option too, is just to find out, you know, a bit of research. There are different avenues. It's not just the one, you know, and you hope that your GP will give you all the options, but it's not just one way, you know.
Yeah.
So,
Were you familiar with the group Birth Choices at all?
No.
That's a consumer group
Sounds good though.
that exist, and they are designed to educate women and empower women to choose the sort of birth experience that they want. So that's just another resource available to women out there who don't really know what they want yet. But like you say, your general practitioner can be a really good source of information, or like you say, friends and other people that have been through it recently or not so recently. So okay, well, I've got just one last question for you, Marika, if that's okay. What, from your perspective, what was the most important skill that you feel that or practice that you integrated into your sort of daily routine, or just in terms of your pregnancy preparation for birth and motherhood? Do you want to talk about that?
Yeah, okay. I think I didn't know first time around. I didn't really have anything in mind. I think lots changed for me after that first birth. But I think, if you can have some sort of a mindfulness practice and a knowledge that you can do it, like that your body can do this and it's designed to. And, it's hard to feel that if you're not in a certain place in your life, I think. I certainly couldn't before. But by the time the second and third, I just knew I could. Probably I'd done it before, so that was a big part of it. But I also was in a headspace where I just knew myself better, and I knew that, no, I can do this. And I think, it is going to be hard, particularly if you're choosing the natural birth route. It's hard. Yeah. But you can do it. It's incredible what your body can do. It's absolutely amazing, and it'll blow you away. But perhaps some sort of affirmations along those lines would be helpful, just to, I can do this. I've got this. I can do this, and I am safe. I will be in good hands, and yeah. But I guess there also needs to be a level of anything can happen, and be okay with if things shift. The goal is healthy mum, healthy baby. We don't, because I do think sometimes you can get really caught up in how you want it to go. And there can be a lot of issues afterwards if it doesn't happen that way. But as long as you're both okay, that's the biggie, So.
And you did mention that you read some books. I think it would be great if you could share those titles or authors with people watching, because I think that's a resource for
the
them.
main one that really affected me in the first pregnancy and made me want a home birth actually was called A Labour of Love. Now, it's by Gabby someone.
That's okay.
But A Labour of Love.
Okay, we can look it up and I can pop it as a note underneath the video.
Yeah. And I think I read some of that Spiritual Midwifery as well. Mae Gaskin. Yeah, that's it. Now, what else at that time? I think they were the main two.
Yeah.
That just, and it just showed me that home birth was an option. And it made me think, my body can do this, and, I can. But, I was happy not to have a home birth the third time round. I had kids at home and I was happy to be in hospital for a few days. That was perfectly fine, Yeah. And the options that Bustleton had were great. I could have a baby in the pool, and, that was important to me as well. So, yeah.
Lovely. Yeah. All right. Well, thanks so much, Marika. Was there anything else that you wanted to share before we finish up? Any sort of, finishing comments or other words of wisdom?
Yeah, you wrote a question about parenting, and I was thinking, the jury's still out on that. I'm still working that one out, the parenting.
Yeah.
That is one part.
Yeah.
But I probably, really lean on your support groups, just really gather those people around and don't be afraid to use them. And there's a lot of helplines, and I do remember with my first two, there's a lot of time where I was like, what about this, and what about this, and what about this, and my head was racing with questions, and I felt a little bit like I couldn't ask, but you can, and you just got to write them down and ask someone, and I guess, things like mothers groups are very helpful. It's good to, particularly first and second, your first time around, having the people going through the same thing so you don't feel like you're going crazy. It's a good one. Try and keep those people.
Yeah. So, I really echo that. I mean, I think That's probably the most important statement I leave with women when I discharge them from hospital is, if you have any questions at any time, please just call and ask, because, you know, it's often a very simple thing for us to answer, and it can, you know, really provide you with a lot of relief and reassurance to have an answer to the questions that, you know, keep you up at night. You don't need to be kept up any more than you're already being kept up by your newborn. So, Okay. Well, that's wonderful. Thanks so much, Marika. I really appreciate you putting aside some time and sharing your experiences with the people watching. So we'll wind up now, and you can go and enjoy the rest of your day.
Cool. Thanks, Sarah.
Okay. Thanks, Marika. Bye.